Welcome back to the show, everybody. Today's episode is an interview with Faraz Khan, who is a longevity and hair expert. And our topic today is all about hair. And this is a project that is very near and dear to Faraz's heart because this is an issue that he himself has dealt with. And if you were to look at his picture, which hopefully you will, you can either see him on YouTube on this interview, which I will put up on YouTube, or also you can find him on Instagram, which I'll give you the links for later. You will see that he is a walking testimonial for his product line, which is called Fully Vital. So Faraz has made it his mission for the last many years to solve for male pattern baldness. And as a result, he's become a total expert on hair loss, not just from male pattern baldness. We cover all the topics, all the reasons why people might be losing their hair, whether it's from aging, nutritional deficiencies, or a certain virus that seems to be making the rounds these days. So it's a full episode. Hope that you enjoy it. And if you decide that you'd like to try Faraz's hair system, and this is really a system, there's 4 parts to it. There's a nutritional supplement, there's a serum, there's a scalp massage tool, and there's a microneedling tool, which seems to be a big piece of any of these protocols that seem to really work. You will want to go to fullyvital.com if you decide you want to try it before you even listen to the podcast. And you will want to use discount code NAT15, NAT15, and that will give you 15% off your product, your purchase. And also know that Faraz stands behind his product. If after 3 months of following his protocol and using this product every single day, you haven't seen positive results, he will actually give you your money back. So I can't think of a better offer than that. Anyway, the episode, like I said, we cover a lot of topics all about hair. And people have made movies about hair. We love our hair, right? So it's a good one. Thank you so much for being here, you guys. I appreciate you all. And of course, if you get value from this episode, please make sure that you leave us a review and that you share it with your network, your friends, your family, anybody else who you think will get value as well, because this is how we get the word out. So thanks again and enjoy the episode. Hey folks, just a little bit of housekeeping before we launch into the episode. Please remember that all of the information provided in these podcasts is for information purposes only. We are never offering treatments, cures, whatever for any kind of disease or medical condition. Anything you hear about here is going to be intriguing. There's some research around it, but make sure that you check with your medical provider before you go off and do any of this stuff for yourself. All right. So, enjoy the episode. And also, if you're looking to connect with me for any reason, with your comments, questions, whatever it may be, you can reach me through my website, which is natnidham.com, or you can find me on Facebook in the Optimizing Superhuman Performance group, or on MeWe in the Biohacking Superhuman Performance group. And of course, you can also follow me on Instagram, which is at Natalie Nidham. Natalie is with an H between the T and the A, the second A. So thank you so much for being here. Appreciate you guys. Enjoy the episode. Hey, Joe, it's a pleasure to finally meet you in person. I have heard so much about you and spent so much time on your websites over the years. Welcome to the podcast.
Thank you for having me. I appreciate the kind words.
Yeah, no, it's, you're definitely a presence, I have to say, and very well respected. So you've done some really amazing work in the space. And I guess one of the things we can start with a little bit is, and you've probably told the story a lot of times, but every podcast has its own audience. When you sent me your bio, one of the things that you said that really stood out to me is, I thought that you'd won the lottery on bad genes. And I was just curious to know what that means. And maybe you could tell us a little bit about your story and what brought you to do what you do today, because you've done a couple of other really interesting things.
Yeah, so I'll go through it. I got into this, as a lot of people in health, to solve their own health issues. Mm-hmm. And I had health issues that doctors weren't able to properly deal with. They didn't have the right tools. the right know-how. And so I just kept on bouncing around trying to understand, like, why am I tired? Why do I have brain fog? Why do I have gut issues? Why do I have sleep problems? And a whole host of issues. Why do I have inflammation? And, it's clear to me that the current system was not going to give me the answers.
Mm-hmm.
So that's when I kind of went into self-detective mode. And I said, okay, I have to figure out biology and how the body works. And, and a critical part of that is genetics, lab tests. What are my symptoms? Like, just piece everything together. And so I started that journey really in 2009 around.
Okay.
And, it kind of took a turn in 2011 and 2013. 2012, those years, my health took a turn for the worse. And that's when I started just to say, okay, I'm going to get into this full time. And I started, looking at all my lab data, my genetics, and I was pretty early into this field. And
Mm-hmm.
so, and I had to, there was a learning curve with everything I was doing, and I was just spending all my time doing research. And that was the genesis of Self-Hacked, where once I made a big improvement in my health, I was able to start something, right? And I initially started as just like a blog of my own research, just what I was finding, and then it turned into, hey, this is an important resource. People want more structured data, and so I started hiring scientists to write for me. And I was doing consults for a long time, and I started understanding people. And what was clear to me is that on an individual level, there's no tools to be able to use the data that I used to get healthier.
Mm-hmm.
And or either to figure out what's going on or to understand how to get better.
Right.
And so that was me going in deep into all these things. But then once I started helping other people, and I was obviously interested in genetics for myself and different tools for myself, but once I started helping people, it even became more clear. A lot of people are just missing the basics of they don't have their genetics, they don't have their lab tests in order. It's just kind of like they don't really understand what's going on.
Mm-hmm.
And so I felt like we needed proper tools in order to help people.
Yeah.
At that point, we had a lot of posts on Self-Hacked, and people weren't able to find what was relevant to them. People didn't know, they didn't understand like how to go about and solve their issues. And so they would, I think a lot of people just kind of go around in circles for a while.
Yeah.
And they spend a lot of money, and a lot of things don't help, and people are blind. And so I felt that as well. And so I felt like we needed to have the right tools to be able to service people who wanted to, either practitioners or users, to be able to take control of their health.
Yeah, so that's a great idea. But so now 2009, that's going way back in genetics. Like we've come a long way in understanding genetics since then. And I think every minute of every hour of every day, somebody else is discovering another nugget of information. I mean, it's one thing. I've studied genetics a fair bit myself, and it's definitely one of the things that I think keeps you real and keeps you humble, is knowing that we think we know what we know today, and a lot of it could change tomorrow. Or even understanding, the backup systems that the body may have in place that we don't even know about yet sometimes. And I think that's one of the really interesting things about genetics is, and I'm sure that, and I know you do this also, is helping people to understand that just because you carry a certain genetic variant that we understand today might put you at a predisposition for XYZ, or say that you don't process a certain nutrient appropriately. The body does have a lot of redundancies built into it. And there may be another pathway in there that we don't necessarily understand or know about yet, that's kind of picking up the slack, sort of. So how did you how did you, what was the state of information in 2009 when you started, and how much have you seen it change since then?
So I didn't get into genetics in 2009.
Oh, you
I
didn't.
just
That was
got
just your own self-healing journey.
correct. That
I
was,
see.
yeah, that's when I said, I'm going to spend full time trying to understand, what's going on with me, how my body works, things like that. When I got into genetics, it was around 2011, 2012.
Yeah. Still a while ago,
Um,
though. Yeah.
yeah. Over 10 years ago. And I got it, and I was not that impressed with what was out there, different tools. And, I mean, didn't plan on doing anything on my own, but I just, I was basically looking at studies. What does this SNP mean? What does that SNP mean? Things like that. I would say that the field has dramatically changed, and my understanding of the field has also dramatically changed. And I think part of that is based on being in the industry and really understanding what's going on. Because I think there's a lot of confusion amongst the public about this whole genetics thing.
Yeah.
And some of that I think is, again, so the understanding of the science community changes, and the understanding, right? There's the science community's understanding, there's the individual understanding, there's companies, there's all different kinds of, understandings. When I got into it, I was looking at individual SNPs, and I was thinking, how can I, what it was helping me understand my biochemistry. Now, that was a very long journey, because I got to spend years reading various papers and my SNPs and things like that. That's not like a journey you could really replicate, right? It was very clear that we needed good software to deal with this. And so I started developing a software in 2015, and then I went full, like I did it seriously in 2016. And that's when I was also developing SelfHack at the same time. But it was very clear to me at that stage that SelfHack was limited by the lack of precision. SelfHack is like an encyclopedia of health information that is written in a lay-friendly way, right?
Yeah.
But it was very clear that that's not the future. And we started doing on supplements, lab tests, genetics. We started posting on all these topics from an early time. Genetics post from 2014 already, even 2013. So I already started to transfer to speak about these things a little. And so 2016 and 2017, I started trying to put together a team of the right people, and we built a product we built products in 2017, and then I hired a good geneticist, and someone who was very good at I thought was very good at the science, and he basically designed a new system. And I said, I want the best science out there. And we looked at the competing reports and whatnot. And so we said, let's give like all the best SNPs. Let's do like as legit a product as we can. And each report had around up to 100 SNPs, which was, a lot compared to what other people were providing, 1 or 2 SNPs. And we really had like a system. We had recommendations, and there's a lot of good things there, a lot of good information. And I think that, some degree it was helpful. But when we did that, we kind of looked at what we did and said, what are the, there was a few things. Number one is I kept, I kept looking for somebody who could really run a science team well. I had a geneticist that kind of, he was a geneticist, but not really a great manager or anything like that. So I was really searching for the right team. And finally I found the chief science officer. And I, throughout that journey, I always said, hey, we need to make sure that everything we're doing is scientific. And all the scientists were like, yeah, of course it's scientific. And so, but as I was recruiting, more and more people, and I was looking for the best people in the industry to be able to, build the best products. I found a scientist who basically came in and he said, look, there's the latest genetic science that has just come out. It's 2018, 2019. The way you're doing things is not future proof. And he explained why. He said there's very few people who really understand this because it's a very specific field. It's like it's not just medical genetics or anything like that. It's a very specific field. And so he basically explained, like, you have to do like all these things to really do it right. And it's a huge project.
So which things does he feel needs to be done in order for this to actually be useful? Because clearly this is a point of differentiation between what you do and what many of the other companies, and there's like a new company doing genetics every 10 minutes out there. So.
Correct. So yeah, it's not, we don't, it's not exactly about what we're doing. We're doing what basically I said, okay, this is what we're doing is not legitimate enough it's not up to date enough based on what the scientists have created. And they were good scientists. That's what it's not using the most updated methods. And I'm explaining this, this is what we set out to build, but also so that people understand what goes into, like, what are the different models here? What are different people using? Basically, what he said is, what the research came out in 2019, 2018 is that when you look at these specific variants that pass they pass rigorous studies and there's a very significant impact or whatever, but when you add those up, it's actually not that significant, right? And the reason is because it turns out there's millions of variants that contribute to each trait.
Yeah.
And if you just look at a select group that scientists will curate, it doesn't improve. It doesn't allow you to use AI and machine learning in order to look at millions of variants and be able to have a much better predictive model. And then he also said you cannot make recommendations based on genetics because it's just not valid enough. We're not there.
Or not genetics alone anyway.
Not genetics alone, exactly.
Yeah, no, I tell my clients that all the time, for sure.
Yeah, if it wasn't at all had to do with genetics, then what are we doing, right? So
yeah,
it's not alone genetics, right? That's an important part. So we started to build up the system that was, that was legitimate, and we completed that in 2021, beginning of 2021. We've been building more and more reports on those topics. I'll explain what some of the differences are. Number one is, so the way that genetics was done previously and currently by almost all companies is they're using specific variants, like I mentioned.
Yeah.
That has to be moved to, that has to be moved to a big data model, because you're not going to just be able to look at specific variants and say, this is what's going on, right?
Yeah.
You have to look at a lot of data. And when you're looking at 1 million data points, you have to use software.
Yeah.
You have to use AI, machine learning, and you have to design the platform so that it automatically updates as as new studies come out and as better methods come out, more data comes out. So there keeps on being more data. The more data you have, the better your prediction models become, but not if you're using specific variants, right?
Yeah.
Just if you're using a big data approach. So that's one thing we built out, and then but to build that out properly is quite expensive. I'll tell you why. What goes into it, like what are all the different aspects. First, you have to process a file in the right way, and it's not just taking specific variants from a file. Every file you have to do what's called imputation. Imputation is this process where you predict variants based on existing variants that an individual has. So people tend to inherit variants together. What that means is that if you genotype 700,000 variants, you can actually predict with a pretty high degree of accuracy all of your variants, 300 million SNPs, all of your single nucleotide polymorphisms, which is 300 million. And what that means is that there's 300 million variants that have been identified single variants that have been identified as being different from one person to another. Now, most of them are rare, and so, but there's about 10 million that are quite common. But the first part is you have to impute all these variants, and you got to do it.
I have a question. Sorry. So when you're saying you have to predict variants, like you're predicting other variants of other SNPs that you're not directly measuring?
Correct.
And what's the value of that? Like, do we know what these other SNPs do?
So some of them, a lot of them we don't.
Yeah.
But when you have an AI machine learning, it's able to take stuff that you don't know and basically figure out that there's, hey, there's this pattern between people with these group of genes and this condition or this health issue.
Okay.
Right? And so, and it allows us to figure out what are variants that are having a bigger impact. And some of that research is being used, let's say by 23andMe, for example, to find drugs, because if you can look at the variants and see, okay, these are going to have an impact, you could try to find drug targets and things like that. So it is used by the pharmaceutical industry quite a bit now in order to find drug targets. But the bottom line is, and you could also do whole genome sequencing. The vast majority of tests that people do now are genotyping. So they're looking at a variety of important variants that have been selected. But where that breaks down is that you're looking at 700,000. You really need to be looking at all the variants and trying to, and using big data to see, to come up, to see what are, when you have a big data approach, it can be giving very small increases of risk to a whole bunch of variants that might not pass a certain kind of level, a certain kind of threshold, but each individual variant could contribute a small amount.
And so are you using the AI? So the AI modeling that you're using, does that information now go down to each specific person, or are you just using that to learn so that down the road you'll be able to come back to someone and say, look, here's what we've learned from people who carry whatever variant, this variant, we've learned from this giant data set that we have that people who carry this variant, this variant, this variant are likely to X. Is that the goal?
That's a very smart question. That's a very smart question. And based on that question, I can tell that you're quite smart. But yeah, it's on the individual level. So it could be used for both on the individual level and also population level and things like that. And we use it obviously on the individual level, but the same technology it can be used in different ways.
And so when you learn it on but you're not saying to someone, because I mean, based on what I've learned in genetics is, I mean, we get a genetic report for someone. It tells us, let's say, that they're at a higher risk of developing type 2 diabetes, or, they carry a certain number. And I would say that any of the genetic companies that are worth their salt right now, and that's not all of them by any stretch of the imagination, is using AI to some degree, because I think people should know by now, hopefully, that a single SNP, the report on a single SNP without looking at its environment of other SNPs around it is almost pointless. Like the body just doesn't work that way. It just doesn't work.
That is exactly what I'm saying. I did not realize that until first of all, I didn't realize how many variants were impacting until I really spoke to some top scientists and I brought on someone who really understands it. But now you might be surprised to learn that companies are not doing that. And it's very easy for me, who runs one genetics company, to see if companies are doing that, because I know exactly what talent you need in order to do that correctly. And so I just look on LinkedIn who works at this company. They don't have the talent. So there's nobody that has the talent, direct to consumer, that is actually doing that stuff, except us and 23andMe. Just to be like, 23andMe does, the difference is they're not they're not doing a lot of reports in the sense of like, they're not giving recommendations. It's a very different platform, 23andMe. But if you use their ancestry, you'll notice that it's pretty accurate, right?
Not in my case.
No, it wasn't in your case. Okay.
I don't
How
think
long
so.
ago did you use
Unless
it?
I've got my ancestry very, very, very misunderstood. It has me being like 90% Italian. There is no Italian in my world.
How long
And
ago did you get that?
A couple of years ago.
Okay, interesting. I mean, for mine, they pegged me pretty much 100%.
Yeah.
So, I mean, yeah, I can't say that everything that they've done is maybe they made some mistakes. Maybe it was a mistake in your case. But what I'd say is they do have the talent to do it right. They didn't do it right in the beginning. I don't know exactly. They're not doing the most up-to-date methods just because that they built the products a while ago. When, you know, and the methods have changed, but they have the talent to be able to do it correctly. That's all I can say, right? It's hard to, they are doing things legitimately. I can't say, you know, but it's a very different product. I think people use 23andMe and they're like, you know, this is not really telling me much about my health or anything useful.
Well, that's not what it's, to your point, that's not what it's designed to do. I mean, 23andMe has almost become a data collection company more than anything. It is not a great direct to consumer company. And, you know, again, like, I think there's a couple of, I would argue there might be one or two companies out there that are not direct to consumer, that are doing a reasonable job, or at least are in the sphere of what you're doing. But
correct.
But in the direct to consumer world, I agree. And I think the direct to consumer tests quite often just confuse people, or causes them a lot of anxiety.
Correct. So I would say that I mentioned in the direct consumer world, right? So there are certain companies doing it very specifically, not a lot, but there are certain companies doing it in a correct way. And they're not doing it direct to consumer. You know, they're doing it more for specific diseases usually. And so, and again, I don't want to, I didn't mean to imply that I would use 23andMe, right? So there's problems. I don't think they're giving, you know, good health reports, or I don't, you know, they're not giving any recommendations. And you're right, their business model is based on selling your data.
Yeah.
I mean, I think that's pretty clear to everybody. That's not a secret, right?
Not anymore. I think at the beginning it was a surprise, and I think now the cat's out of the bag. So the good news is people that choose to run their data through 23andMe at least understand that that they're taking part in a greater project, as it were. And
correct. I mean, yeah. I mean, they're helping, you know, and their business model is collect as much data and try to use that to discover drugs.
Right.
You know, it's a different business model than what we're doing, but yeah, I mean, our business model is completely different, right? It's not getting the data, selling it, discovering drugs. We obviously we're not selling anyone's data. It's just we're using it to generate.
That's pretty verboten. So let's get into some of the things that people can learn from running their data with you guys with SelfDecode. And let's help them to understand a little bit of what they're getting, right? So what is, you know, if somebody gets told that they have a genetic, are people being told, like, what is it that people are being told? Are they being told you have a genetic risk? Here's what you can do about it. Or you need to go look at these other metrics in your health data to assess whether or not this is an issue for you. Like, to what degree do you take this whole, how you tell people what to do? Yeah,
so it starts, we have these comprehensive reports on each topic, and it starts with, here's a genetic predisposition. Here's where you fall in the percentile of genetic predisposition. And if you're like me, let's say you're 99% gut inflammation or IBD, which is what my report has, and I've had IBD in the past. So, you know, there's obviously a strong genetic predisposition, and it's, you know, and it has expressed in the past when my lifestyle was a certain way. Now, just giving predictions but not, likelihoods. These are probabilistic models. Without the recommendations, doesn't really do that great of a service to people. So every report has a list of 15 to 30 recommendations, and the recommendations are basically, they're from the top to bottom based on impact and evidence. We have some algorithm that puts these recommendations top to bottom based on evidence. Now, currently we show the top 5 to 7 recommendations, but we're going to very, very soon be showing all the recommendations to everybody so that they can see top to bottom, keep on going down that list and see what they want to do. But yeah, essentially, and part of the ranking mechanism uses genes and specific variants to see, okay, based on these variants, this is going to have a slightly more of an impact for you, and therefore the recommendations could change.
Oh, interesting.
Right, based on specific variants.
So two people who get told that they have a higher predisposition to develop type 2 diabetes, I'm going to hammer that nail until it's dead, only because people kind of understand that one, right? Might get different recommendations.
For sure. Yeah. So, the top 5 are not going to change drastically, because let's say for type 2 diabetes, right, it's very clear that exercise is going to be in the top 5 based on the impact, right?
Sure.
And, some people might be a little more of an impact, some people might be a little less, but whether it's number 1 or 3 or 5, it's going to be in the top 5 just because it has a really big impact. So that's kind of how we do things, is that nobody's recommendations are the same, but there are certain recommendations that, there's no way about it. It's just, if it's going to have a very big impact and there's good evidence for it, then we just are going to show it higher up. But, that's kind of also why we're showing all the recommendations, so that an individual can see that, hey, I already exercise, I already do this, I already do that. They can keep on going down the list from top to bottom and see what are all the recommendations that make sense from them, from 1 to 20 or 30.
Right. And so does your system also take into account, let's say, in terms of type 2 diabetes, which is very aligned with insulin resistance, and then looking at how people do with, let's say, high fat intake. Some people do quite well with a high fat diet. Other people won't. Some people, it may actually drive insulin resistance, which as a result may drive their risk even higher of developing the type 2 diabetes. Like, do you have that kind of linkage built into your model as well?
Correct. Exactly. So
Yeah.
If there are specific variants that show that somebody is going to do worse on something or better on something, that will change the impact to the individual, and that will change the place in where that recommendation shows up.
Nice. I like that. That's really where it's at, right? And so do you offer in your service, is there any way for people to talk to anybody? Like, do you have people that you work with, or are you able to point people towards other, whether it's coaches or practitioners or someone who can, because, one thing I've kind of learned, and this is from running a fairly large Facebook community, and, as much as we give people a lot of information, at the end of the day, most people don't have the mindset or the wherewithal or the time, let's say, or maybe the confidence to kind of take all this information and turn it into something real for themselves. And, even in as much as the quality of the information you're giving is so great, to help people to apply it and to take it to the next level is kind of the next step, right?
Yeah. So I think what we have can be seen as a decision support system, meaning, you're not getting anything 100%. Here's a diagnosis. Here's this. You're seeing, okay, here's my genetic predisposition. You could also upload labs. You could see what are the risks that you have from labs. And then you have recommendations, but, it is helpful if somebody doesn't, it is helpful to have somebody who, is, whether either there's a coaching aspect to it, right? So the coaches can be helpful. And then there's also somebody who can help guide people based on a somewhat complex field. And so there is a need for that. I think there's definitely a strong need for that. And that's why on our platform, we have the ability for people to do that, is to basically coaches to have clients on the platform to help them out.
I see.
We have a place where people can, it's not something we really market that much, because it's not our main business model is to deal with coaches, not yet. I mean, when I say we want to introduce like a platform for people to find coaches and, basically to connect coaches and individuals, because we think of that is a valuable service. But we don't have that right now. But as a general rule, I think it could be useful, right? And even if you go to the gym, I mean, you could go to the gym and pick up weights and you'll do fine, probably. But we also know that a lot of people have trainers, right?
Yeah.
And
yeah. You'll always do better with a trainer, for sure.
Yeah. I mean, they teach you, okay, don't do it this specific way. They motivate you. And so there's a few aspects. They keep you on track, and they're also making sure you don't do stupid things. Stupid to them, but not maybe to a non-expert, right? And so that's kind of where a coach could come in, is like, making sure, guiding an individual, making sure they don't do like get hysterical about some things, or or implement some recommendations that may not be ideal for some other thing that is going on with their life. You got to look, having like a broader understanding can help, and then also to motivate people and help them implement that.
Yeah, no, for sure. So, I mean, we were talking before the podcast, and you said you were talking about, what I'd like people to walk away from here is understanding, at the very least, whether they use my platform or not, what should they be looking out for in a genetic test? When somebody says, I've got this great genetic test, you need to, that'll be the thing for you. What are the danger signs that they should be looking out for? And what are the things that, what are the hallmarks of what you would think a company is, a company that's doing a reasonable job at what they're doing, from what you know?
So number one is, if you are going to trust the risk score, you have to make sure that the company has the right personnel to do it, which is very specific personnel, like I said. Now, you could use a platform without trusting the predictions, right? That's a
little risky.
I think, yeah, I mean, but but I would say that there's a lot of things that need to be done. The file needs to be processed in the right way, it needs to be imputed. There needs to be deep ancestry on it. There needs to be a big data approach. So, and we're also publishing on our methods in how we're doing these things so that we're proving that this is legitimate. Now, I think so that's number one. If you want to trust the methods, I would say look into what companies are doing. And part of the way that we're trying, our goal obviously is to have as big of an impact as possible. And one of the things that we've done is we said, there's a new genetics company coming out every day, right?
Yeah.
And every day we see that these new genetics companies are not using the best methods. And so what we've decided was, we're not going to hog what we've done. We're going to offer it for, affordable price to other companies to integrate it into their platforms. I think when you have, so that's kind of the service that we're offering to other companies. Say, hey, you don't need to be doing this in an outdated way. Why don't you use our platform that's already built out?
Nice.
And so that it kind of, you don't have to deal with that. And then I think after that, there's companies could do a whole bunch of things that they use the data with, right? I think you want to use it in a way, and then you want to go deeper on certain issues, whether it's type 2 diabetes, like you mentioned. It could be, you got the basics, the score, you have recommendations, you've got content there, but you could go a lot deeper and say, hey, okay, tell us about the medications you're taking, or tell us about what you're doing, your diet, and then we can bring you on this journey to, make it better, right? We're not going deep on any particular topic and saying, here's the type 2 diabetes journey, right? It's more of a broad-based platform that, is trying to do it on a more big scale. But I think there is room for that. There's room for coaches. There's room for other companies to go deeper and lead people on a journey and so I think I don't think that just I think educating is a big part of
It's
making
huge.
people change. Yeah, and I think
Yeah, I think it's huge.
how you educate is very important, right? There's a basic education, and then there's going deeper in certain areas, having a coach, things like that. And so I don't think that other companies in this space are just a complete waste. I think if they're using the right science and they're going deep on certain topics and they're educating properly and they're giving people good information, I think that is definitely a value add. We're just trying to support other companies as well with the basic infrastructure, so they don't have to, so that they can do it correctly, right?
Right.
Yeah.
So you're operating at different levels, really. You're doing your direct to consumer business, but you're also offering a service to other companies that want to get into the space where they can use what you've developed and almost like a white label kind of deal.
Correct. Exactly. And also to health coaches who want to get in and use it in their practice. So there's 3 different models that we have. There's the direct consumer, there's the practitioner and model where people have clients and they can upload and do a whole bunch of things with lab tests and genetics for their patients. They could see what's the highest risk here, and then they can help their patient in various ways. And so there's and for me, for example, after when I come on my dashboard, it tells me what are the main things what are my highest risks. It's just cardiovascular, brain, inflammation, and gut, right?
That's enough.
Yeah, and I'd say that looking at my history, which is pretty public, it's pretty damn accurate. Like all of the ones related to brain were quite accurate. The ones that were related to there's a couple related to cardiovascular, but a lot of the cardiovascular risk came from my lab tests, and my family is high risk for cardiovascular disease. I know that. Right. So
there's often something to that. Yeah.
Yeah, exactly. So I find that for me, it was quite, and then I got good recommendations from it. Now I'm quite an advanced user. So, even though I knew a lot of stuff already, obviously, and I tried a lot of stuff, but even so, it was still able to help me. And I find that I keep going back to it and learning more every time, every time I go back to it.
So are you finding that people get better data and better results? Because I've been in there, but I'm going to admit I didn't spend a lot of time in my own dashboard. And I don't think I've uploaded any labs yet because I just haven't had labs done in a couple of months. And, the thing with labs is they're a moment in time. So loading in your labs from a year ago and looking at them today is not necessarily going to be that helpful. However, and again, I'm going to ask this of the platform, does the platform track labs over time? Because it's where the real value of labs is, well, there's 2. One is if you've got something crazy going on right at this minute that needs to be dealt with. But the other value of labs really is looking at them over time and looking at trends, right? So someone who has, again, beating that poor nail down into the ground now, who has that high risk of type 2 diabetes, watching that their HbA1c, no matter what is just creeping up over the years. And I see this a lot on people's labs. Like they were quite low 7 years ago, and every year it goes up, and like the tiniest little increments, right? So does the platform, because we're starting to cross into a world where you're almost giving medical advice, which I'm sure is a line that you're very aware of and not crossing. I mean, even as a coach, I have to be super careful. I don't cross those lines. So I've probably asked you 3 questions in that little rant there, but do you need me to rephrase?
So yes, number one is we're tracking the labs. I could
over time.
Do people see my screen if I share?
Let me let you share, and then for people who are watching this video, they can see your screen. You're good to go.
So it would be a little more helpful just to
For
show
sure. No, I
people,
think that's
for
really helpful.
example, yeah,
Yeah.
just for a few minutes. So if you could see, you see cardiovascular is
Yep.
here, and it
Yep.
says 7 lab risks and 2 genetic risks. Brain is here. You could see 7 genetic risks.
Yeah.
And there's no, there's no labs really for brain. There's no really good labs. It's mainly, it's genetic type thing.
Well, but what about things
I mean,
like QEEGs or anything? You're not right now, you're not taking that in, or is that still so new
we're
that it's
not
not
taking
quite?
it in, and we're not taking it in, and I haven't done it myself. So it's not going to show up here.
Right.
No labs, right? There are some labs, but I don't think I uploaded any of them, right? So our platform allows people to buy labs, and so you could go and get some, but I haven't uploaded any.
And is that
But let's say
international or just in the States?
international. So you
Okay.
can see here that let's say cardiovascular,
Yeah.
there's 2 genetic risks, but there's 7 lab-based risks. Right?
Okay.
And if I click on, let's say LDL cholesterol is, and it's basically giving it based on the top high, most out of range. But let's say, LDL cholesterol, if I click on this, it brings me here, right?
Yeah. Oh, so it shows
And
you
you
over
could see-
time. Okay.
Correct.
That's really
And
interesting.
this is, the green is the optimal range. You can see optimal, so, and then high, right? And
Very
so
cool.
you could see how you're doing over time. And then there's a lot of content, and there's recommendations for the labs. And so you could see, and all the content is written on 8th grade level, so it's not too complex.
Yeah,
right?
yeah. I have a question. So when you're looking at the ranges, let's say for LDL cholesterol, and cholesterol is a really good example because this is such a contentious topic. What is normal? What is optimal? Are you using what parameters are you using? Are you using more conventional medicine parameters, or are you using more of a
We're using what the
functional
science says.
Okay.
We have a team of researchers that are just looking at the papers. They don't have any dogma about
So there's no
functional
biases. Yeah.
we don't care about functional, conventional. We care about what's in the scientific literature. That's all we
Okay.
want to know, right? I mean,
Yeah.
you have to have a standard, right? I mean, we can't do hypothesis driven approaches, whereas like, oh, this is our hypothesis. We have to use a standard, and that's based on what is in the scientific literature.
Okay. Yeah. I mean, I guess if on a function where the functional world is a little bit is maybe they're also applying a different lens to it in terms of what they've clinically observed. But it's, it's a whole
Sure.
different, but I mean, and not to say that functional is not based on papers. I actually think it is. And maybe the functional, and maybe you guys are doing this anyway, is you're looking at the more recent literature, whereas a lot of the conventional dogma is based on older research and hasn't necessarily kept up with the times.
Correct.
If we
not
say
everything
that,
that's not everything that's conventional is going to be, a lot of things that are conventional are not going to be correct. It takes a long time for the system to move.
Yeah.
And yeah, I mean, it's just, I don't really have any, I can't change what the science team does. If I do my, it's like if I have, I don't necessarily personally agree with this, doesn't matter. This is what this is what the science says. It's just, I don't have any inputs for the recommendations for nothing. I don't have any, I can't say I like this for gut health. Yeah, but we don't have the proper evidence to, there's no published studies that's clinically, no published clinical trials that show that.
Okay.
And so I'm not saying, and you could say that that's a gap that could be filled by either coaches or practitioners or other companies that have, a hypothesis driven approach that could be on top of what they're doing, right? On top of what we're doing here.
Well, I think that what's the most important thing is transparency, right? If you are, and I think you're very transparent from the sounds of it, if you're fully transparent about what your parameters are, what it is you're looking at, what your things are based on, at that point, it allows people who are using the platform to know that. And then if they have their own bias or whatever the case may be that they're coming to it with, they can apply that over top of what you're presenting them. But and if you guys are listening to this podcast, this is one where you might want to go to YouTube, because we're looking at Joe's screen here and looking at his results. And so you'll be able to see what we're seeing, which is a pretty robust back end. I mean, if you're just screening up and down here, but if we, what's also interesting here is we've got a supra optimal level and an optimal level. So there's high, critically high, super optimal, and optimal. So at least you're also giving people ranges. You're showing where they are on that range. So let's say I don't agree with where the optimal level is. I can look at where that number is and say, okay, well, I'm comfortable here, even though your platform might say,
correct,
that's not where I should be.
And then you could look at the studies too that we're we're citing, right? You could say, hey, let me check out these studies, and you could see here what can increase LDL cholesterol. And you can look at the studies, and again, we have a team of scientists doing that, looking at the studies. But again, it's something that you could decide for your patient that, hey, there's benefits to having higher LDL cholesterol, right?
Yeah,
I mean,
for
my
sure.
opinion. I think that, but that's where kind of like a health coach comes in and says, you know what, for you're dealing with autoimmune issues more. I don't think it makes a difference. Like, this is not something you need to worry about. Right.
Yeah.
And so that's kind of where I think like practitioners could come in, or a specific platform that's really focused on that. But yeah, so like, let's say if I look at gut inflammation.
Yeah. I was going to ask to look at that actually. Yeah.
Yeah. So you see, I'm in the 99th percentile, like I mentioned, and this is based on a model of IBD, and we call it, but we call it gut inflammation because that's really what IBD is.
Sure.
And it says how many variants we looked at, and so every report has a different number of variants. For example, if we look at the chronic pain one, it's 622,000 variants.
Wow.
And the gut inflammation has 43,000 variants in there. These are the numbers, the amount of variants we looked at to come up with a percentile. And and so you see, in my case, it's high. We have information there. Just what do these things mean? And then there's recommendations, like I said, between 15 and 30. And the new designs are going to actually allow people to look at all of them, right? But these are basically ranked from highest impact to lowest. And so each impact level has a specific formula that we use. If it has many high quality meta-analyses, and this evidence looks really good, it would be a 5.
So this reminds me a bit of examine.com, right? They do a very similar thing with the research, where they'll list, all of, I don't know, I can't remember. Like, let's say you're looking at inflammation, and they're looking at curcumin, and they're looking at a bunch of different supplements, and they will rank the available research as they found it, based on the results, based on the quality of the studies, based on the number of the studies, and then they rank those supplements based on that. It looks like you're doing a very similar thing.
You could say, yes, we are. I mean, you could also say the quality of the team is what will have an impact here.
Of course. Yeah.
I can't say what Examine's team is like exactly. What I can say is that, we have PhDs and MDs looking at the papers and making, following guidelines and coming up with these scores. But you could say that it's something similar to what Examine is doing. Impact evidence. The difference, of course, is the impact changes according to someone's genetics, right?
Right.
And then, so it's a hybrid, you could say, between Examine plus, this genetics, precision health. And if you want to see, let's say, smoking, right? I mean, it's pretty clear, smoking is not healthy, and you could see, for example, people who currently smoke have 76% higher risk of developing Crohn's. Okay.
Yeah.
And interesting enough, this may not be the case for ulcerative colitis.
Yeah, that is interesting, actually.
It's causing gut inflammation nonetheless. And by the way, that could be the case because nicotine might actually be good for certain kinds of gut inflammation, but overall smoking is not good. And then it shows that I have specific genes that make me more likely to develop Crohn's if I'm exposed to that. And so there's 2 of these genes here that say, smokers with my gene variant are maybe at greater risk for Crohn's. And that's kind of how this is going up in impact even.
Yeah.
Right?
No, and that's, it's really interesting because smoking's an interesting one because we've all heard of or may even know of people who are smokers. I mean, not that there's very many of them left, but let's just say we know of people who are smokers who have lived into their 80s and their 90s. And
correct.
Somehow they're like, I mean, I don't know, they're like freaking cockroaches, man, that you just can't. and actually, you know what? It's funny. I know someone who refers very respectfully and lovingly to his grandmother as a cockroach because she's in her 90s. She's been smoking
Right.
a pack a day or more for her as long as anybody can remember. And somehow, and it's got to be living somewhere, like it's got to be buried in her genetic code that somehow her body is so good at clearing toxins and dealing
Correct.
with certain things that it hasn't taken her out like it would 90% of the rest of the population.
Correct. And so you see other recommendations like iron over here, right? And you could see 1 out of 3 people with IBD may not be getting enough iron. And
Yep.
I have a specific gene variant linked with lower iron.
To begin with.
Look at my case, yeah, I've always had low iron, by the way, especially with the gut inflammation.
Sure.
Then what I had to do is I changed my diet and I lowered the gut inflammation. My iron levels have gone up to a healthy level.
Nice.
And so, and by also, changing the diet, I've been eating a lot more meat and things like that. And so you kind of see that, and then you can take a test and see how your iron levels are actually, and you could track it with the system. But the idea is that what we're offering is a platform that individuals can look at with the practitioners, they can look at on their own, and also to other companies who want to build on top of this and say, hey, we want to take this deeper with this specific topic.
Yeah, no, it's very robust. I mean, I'm impressed. I want to spend more time in it, but definitely, which I should have done by now, but it's been a busy couple of months.
Yeah, I hear you.
But anyway, but that was great. Thanks, Joe. Like that's really helpful. And I do think that you're building and have built something that is really, I think you can make a real difference for people and probably already has. I mean, clearly it's made a big difference for you. And, it's funny when you start from yourself and build out from there, right? It's
right.
There's a lot to be said for the value. I mean, I guess in some ways it's just the motivation and the impetus that you put into it. It's so personal. And it's almost like you have this firsthand experience. So you're going to look at it in a way that, well, how's this really going to change things for me and therefore for other people? So
yeah, exactly. Yeah. That is the goal of what we're trying to do. We're trying to and also try to make it cheaper because I think it's just healthcare is and genetics is just it's quite unaffordable right now, and we're trying to make it affordable for the masses so that other companies can start integrating these things. I think that my prediction is that this is going to start taking off in a big way.
Yeah.
I think it's been it's been taking off in some way or another for 20 years, but I think it's been slow because it's proved to be a lot harder to actually implement and come up with a useful tool in order to provide precision health recommendations, right? But we're trying to, our goal is to make it so that people have these tools and that they get, it becomes a norm for an individual who wants to get more information. Is just, okay, I've got my genetics, I've got my labs. And then there's these various companies that are using it on a deeper level for specific niches, for specific customers, right? You have to know your customer. Some people are going to be very conventional. Some people are going to want more alternative. Some people already have a direction of where they want to go and they want a specific kind of help. And so I think that's always going to be the case. And so I think the industry is really going to blossom.
Yeah, no, and I think the whole initiative behind the democratization of access to healthcare is a big one. To your point, correct. A lot of this is inaccessible to a lot of people, and making it financially and intellectually accessible, I think is a huge deal. So I have one more question for you. Are you in any way with your team, even in the background, looking at genetic variants in any way that might impact how people might have certain outcomes with certain conditions or diseases? Like, for example, COVID-19 has been ravaging the planet for the last couple of years now. Some people seem to do just fine with it. Some people do badly. We know that a lot of the people who do badly are metabolically, I don't want to use the word deranged, but dysregulated, let's say. So they've got metabolic challenges that put them at a much higher risk. But even within the seemingly healthy group of people, sometimes you hear about these people that, oh, so-and-so just, had a miserable time or died worse or ended up in the hospital. And they were, fill in the blank. They were not that old. They were pretty healthy. They were seemingly fine. And so barring that they may have had an underlying condition they didn't know about, which is always possible, there's also a possibility that there's certain genetic predispositions that would lead, and we know that there's already a couple that lead to people having worse or better outcomes with some things like that. So are you guys, you're not going to run out with anything to the world right at this minute, but are you guys in the background looking at any of those kinds of things, or is that not on your radar just yet?
It's something that could be done. There are studies that show people with genetic risk factors, and we could use our models on that, and we will. The only thing I would say is that there is a regulatory issue with that. Yeah. And that's why, because the FDA is very, very highly concerned about something like that, where if we say somebody's lower risk, and then they say, okay, I'm not getting a vaccine. Right. You understand the FDA is not going to like that, right? Well, and you're also exposing yourself, right? Because let's say they did get it, and let's say they didn't have a good outcome. Like you're putting yourself in a pretty dicey position. And it's a probabilistic model. You can't say anything 100% sure. So somebody could technically be lower risk based on the information that we have, the latest studies, but they could have some weird variant that we don't know about, up by study we don't know about, but actually, or there's a new Omicron variant and only this variant was tested, right? And the Omicron does something. There's way too many moving parts for sure. Correct. So, but what we want to do is make it available for practitioners who are able to go through it with their patients and give them basically get an understanding of what's going on, right? And their metabolic health and this and that. But I think from a regulatory perspective, doing it without a practitioner is not, is too high risk for us. Yeah, no, for sure. As soon as you get into the pharmacological aspect of genetics, which, it still amazes me that there's a lot of really good information you can get from your genetics in terms of how you're going to respond to certain medications, even things like anesthetic, right? And you would think at this stage of the game that when you're going in for surgery, they're going to run that data and they're going to say, oh, you're likely to need more anesthetic or less anesthetic, or you're going to be more sensitive to this drug or that drug. And it's still not happening, which I think is, it's disappointing. Because even as a patient, if you came in with your report, I don't know that they would necessarily take it into account. Yeah, so we're going to be introducing pharmacogenomics, a lot of medical genetics into it, and but you would need a doctor's approval. Absolutely. We're going to build it in where you get a doctor's approval so that someone signs off on it, and then you could look at all these medical things. And we're going to do it for much cheaper than what is currently out there. And I think, but there's going to be that stuff that is going to need doctors' approval based on just regulatory guidelines. We have to operate within the legal framework. But the health stuff, right? Gut inflammation. Yeah. It's not like somebody's going to die if they have. We tell them they have higher or lower, and it's not like something that the FDA is going to regulate very strongly. Absolutely. Okay, well, that makes total sense. So, Joe, is there anything we've forgotten here, or anything else you'd like people to know? No, I just think that precision health is I'm very optimistic about precision health, and I think it's going to make its way into the mainstream, and I think
Yeah.
every healthcare company in 5 years is going to be using precision health to one degree or another in order to guide people on a more specific journey. And I think everybody should be getting their genetics. If you don't trust 23andMe, if they can get it sequenced with us, I think it's for the money that you pay under $100.
Yeah.
It's a no-brainer to get your genetics genotyped or sequenced, and I think now you have all these companies doing COVID tests, and once COVID disappears, or I mean, maybe it doesn't disappear, but once it is not the
Crisis is
topic
over.
every
Yeah.
crisis, not on the front line, it's not the top story of every newspaper every day. Once that goes away, you're going to have all these companies that are not going to know what to do with their sequencers. And
That's
so
right.
the cost of sequencing is going to go down. But it's really, at this point, it's not a money thing. It's the software, it's the infrastructure, which is holding it back. And that's what we're solving on the market, so that other companies can go deeper, or that consumers can go directly with us if they want, right? We don't mind if they don't go with us. We actually just want people to get good information, and whether that's through a different company or it's us, just make sure they're using the right approaches, and they have a legitimate platform.
That sounds great. Actually, I have one last question for you, because I know this is the question that people ask me all the time, and that is privacy. How do you guys ensure people's privacy of data when they submit their genetic samples to you? Because I think this is the thing that has people completely freaked out. Ever since it came out, the 23andMe was selling information, and even if it's randomized, like the whole 9 yards, people like just get really, and legitimately so. Like, this is as personal as it gets. So before we go, maybe just cover that one last point.
I think it's a really good question. So I think you have to look at the business model. There's two aspects to that. One is the business model of the company, which is, if their business model is to sell your data, then follow the money. I mean, I don't know what to tell you, right?
Yeah, well, that's just just know that it's your information.
The other thing is security. Companies have to have the right security, the right personnel, in order to make sure that the information is secure. So we do spend a fair bit of money on that. And again, our business model, we don't care. A customer can tell us to delete their data, we'll delete it.
Okay.
And and we spend a fair bit of money securing people's data and separating it from identifiable data. We have a privacy compliance officer. You have to take there's like HIPAA training. Our platform is basically HIPAA compliant.
Right.
I mean, it's a very, very long process, and we did all the things that are needed, right? And so basically it's but it was a very long process, and so to get access, I don't even have access to people's data in our platform, because I haven't done the privacy training, and I don't have any specific reason to look at it. And so
nor do you want it, right?
Nor do I want
you want
exactly.
that. Yeah,
right, exactly. So I don't even have access to people's data. It's you have to get certain training, and there has to be a specific need, and so we take a lot of care for people in the privacy realm and security.
Awesome. Well, thanks, Joe. That was great. So thank you so much. Why don't we tell people where they can find you? I know that we have a discount code for people if they want to do their SelfDecode. I wish I could remember it right now. I think it might be longevity.
I can let you know.
Okay, you can look it up. Is it longevity? No.
It's NAT10, NAT 10.
NAT10. Okay, that's the other one I use. I split between the two. So NAT10 is your discount code, guys. But Joe, why don't you tell us where people can find you, how they can get their SelfDecode, and the whole 9 yards?
So they can go to selfdecode.com.
Yeah.
I'm on Instagram, Mr. Biohacker. They can connect with me on LinkedIn as well. And yeah, there's a lot more information that people can learn on SelfDecode.
Amazing. So wait, you're on Instagram as what? The Biohacker?
Mr. Biohacker.
Oh, Mr. Biohacker. That's a pretty good handle. You must have grabbed that early in the game. Very nice. All right, Joe.
Early,
yeah. Well, thank you very much for your time today. It was great talking with you. I really enjoyed it. Thanks so much.
Yeah, my pleasure. I enjoyed it as well.
All right. Bye-bye.